Imagine this. You're sitting at home, holding a letter from your dentist that says you need a crown or a set of dentures. But when you check your Medicare plan, you discover it doesn't cover a penny of it. You sigh, maybe even feel a little defeated, because you know the bill will be hundreds, sometimes thousands of dollars. Or maybe you've noticed your hearing isn't what it used to be. Conversations sound muffled, TV volume keeps creeping up, and you're starting to avoid phone calls because it's too frustrating to keep saying, "Can you repeat that?" And when you finally look into hearing aids, you find out Medicare won't help pay for them either. And what about vision? Cataracts, glasses, glaucoma screenings, vital services that could make the difference between staying independent and needing daily help. Yet again, traditional Medicare doesn't cover much, if anything at all. This has been the reality for millions of older Americans. Until now. Because there's a new proposal making its way through Washington, something being called the Big Beautiful Bill, or BEAP, that could fundamentally change what Medicare covers. And for seniors, this isn't just about politics or policies. It's about independence. It's about dignity. And it's about finally getting the care you need without draining your savings. So today, we're going to talk about exactly what's in this big beautiful bill, why it matters, what it could mean for your daily life, and the challenges it may face before becoming a reality. What is the Big Beautiful Bill? The Big Beautiful Bill, catchy name, right, is a proposed piece of legislation designed to expand Medicare in ways seniors have been asking for decades. In its simplest form, the BBB wants to add 3 essential types of coverage to Medicare. 1. Dental care. 2. Vision care. 3. Hearing care. On top of that, it also proposes to cap out-of-pocket prescription drug costs, provide financial help for home modifications so seniors can age safely in place, offer tax credits, and even training for caregivers. It's being called beautiful not just because of the coverage it adds, but because it addresses so many different needs at once, needs that, until now, have often been treated as separate issues. Think about it. How many seniors do you know who have had to delay or skip dental work because of the cost? Or who wear outdated glasses because a new pair would cost a small fortune? Or who simply gave up on hearing aids because they're often $4,000 to $6,000 out of pocket? The BBB says, enough is enough. Why vision, hearing, and dental matter more than people realize. At first glance, some people might think, okay, nice to have, but not urgent. But that's a mistake. Let's start with dental health. Poor oral health isn't just about a missing tooth. It's linked to heart disease, diabetes, and even pneumonia. When you can't chew properly, your diet suffers, which can lead to malnutrition. It's also tied to self-esteem. A smile is one of the first things people notice. And when you're embarrassed to show yours, you may avoid social situations, leading to loneliness and depression. Now, vision. It's not just about reading a book or watching TV. Vision issues dramatically increase the risk of falls, the #1 cause of injury among seniors. Falls can lead to hospital stays, surgeries, and long recovery times. Poor vision also makes it harder to drive safely, cook, or even take medications correctly. And then there's hearing. Untreated hearing loss is linked to cognitive decline, memory issues, and even dementia. It also creates social isolation. If you can't hear your friends and family well, you're less likely to participate in conversations, and over time, you may start withdrawing from social life altogether. These 3 areas, dental, vision, and hearing, are not luxuries. They are lifelines. And yet, for decades, Medicare has treated them as optional extras. What the BBB proposes to do. So, what exactly does the Big Beautiful Bill promise? 1. Add dental coverage to Medicare. This would include routine checkups, cleanings, fillings, crowns, dentures, and potentially more advanced treatments, like root canals and implants, though the exact details will depend on final negotiations. 2. Add vision coverage. Medicare would start paying for routine eye exams, glasses, contact lenses, and surgeries like cataract removal. This could prevent blindness in thousands of seniors each year. 3. Add hearing coverage. This would include hearing tests, hearing aids, and potentially cochlear implants for those who qualify. For the first time, Seniors wouldn't have to choose between hearing well and paying the electric bill. 4. Cap prescription drug costs. Out-of-pocket spending for medications would have an annual limit, something that could save seniors thousands of dollars per year, especially those with chronic conditions. 5. Support home modifications. This means financial help for installing grab bars, stair lifts, ramps, wider doorways, things that make homes safer and allow seniors to stay in their own homes longer, instead of moving into assisted living. 6. Caregiver support. Family caregivers could receive tax credits and access to free or low-cost training. This acknowledges the unpaid, often invisible, labor that millions of family members provide every day. Real-life impact for seniors. Let's make this real. Picture Mary, age 74, who needs new dentures, but has been putting it off because she lives on a fixed income. Under the BBB, she could get them covered, which means she can eat healthy foods again instead of sticking to soft, processed meals. Or John, age 68, who's been slowly losing his hearing. His family says he's becoming withdrawn, and his memory seems to be slipping. With hearing aids now covered, he can re-engage with conversations and possibly slow down cognitive decline. Then there's Carmen, age 80, whose eyesight is failing due to cataracts. She's terrified of falling. Under the BBB, she could have surgery at little or no cost, dramatically reducing her fall risk and giving her back her independence. And think about caregivers, often adult children or spouses who juggle work, household responsibilities, and full-time care for a loved one. With tax credits and training, they could afford to keep their loved one at home longer, with better safety and health outcomes. Challenges and opposition. Of course, no bill is perfect, and the BBB faces some serious hurdles. The first challenge is cost. Expanding Medicare in this way will be expensive, and lawmakers will have to decide how to pay for it, whether through taxes, budget reallocation, or other means. Second, there's political resistance. Some argue that Medicare should focus on its existing coverage gaps before adding new benefits. Others worry about adding to the federal deficit. Third, implementation. Even if the bill passes, it will take time to roll out new benefits, update Medicare systems, train providers, and ensure seniors know how to access these services. And finally, there's the risk of compromises. The final version of the bill might water down certain benefits to get enough votes, meaning coverage could be more limited than initially proposed. Why this matters now more than ever. We are in a moment where the senior population is growing faster than ever before. By 2030, all baby boomers will be over 65. That means tens of millions of Americans will be depending on Medicare and living longer than previous generations. Longer life is a blessing, but only if it's lived with quality. And quality of life is exactly what the BBB aims to protect. We've spent decades telling seniors to age gracefully and stay active. But how can you do that if you can't chew your food, can't see clearly, and can't hear the voices of the people you love? Here's the truth: no bill becomes law just because it sounds good. It takes public awareness, political will, and in many cases, pressure from voters. If you believe in what the BBB is trying to achieve, you can contact your congressional representatives and share your support. Talk to your friends and community about why this matters. Share information on social media so more seniors know what's at stake. And remember, this isn't just for today's seniors. This is about building a Medicare system that will be ready for future generations, including your children and grandchildren. The Big Beautiful Bill is more than just a catchy name. It's a chance to bring dignity, safety, and independence back into the lives of millions of seniors. It's about giving Mary her dentures, John his hearing aids, and Carmen her cataract surgery. Not because they're luxuries, but because they're essential to living fully. Yes, it will cost money. Yes, it will take effort. But if we believe that our elders deserve to see clearly, hear clearly, and smile without pain, then maybe, just maybe, this is a bill worth fighting for. So, what do you think? If this bill passed tomorrow, would it change your life, or the life of someone you love? Let's talk about it in the comments. Because the more we talk, the more likely we are to be heard. And in this case, being heard could change everything. Don't forget to like, share, and subscribe Timeless Truths for more videos related to this.